Welcome to Wellness Wednesdays. Here's a little information about the University of Arizona Health Sciences and all the different colleges that are included. Here's some beautiful pictures of our two campuses, the main campus in Tucson and also the biomedical campus up in Phoenix. Dr. Michael Dake is the University of Arizona Senior Vice President for Health Sciences. And here's all of our social media channels, so we hope that you will follow us. Please follow me at Medina Wildcat on Twitter. So welcome, I'm Anne Marie Medina. I am the Director of Corporate and Community Relations for the University of Arizona Health Sciences, and I'm located here at our beautiful Tucson campus. You can see the beautiful HSIB behind me. I'd also like to introduce you to the director that we have up at our Phoenix campus. That's Caroline Berger, and then Allison Otu serves as our executive director. Make sure you email us, stay connected. We'd love to hear from you. I wanted to share an overview for today. Dr. Cindy Thompson will be talking for about 20 minutes, and then we'll have time for questions at the end. So you'll have about 10 minutes to ask any questions that you have. Just please put those in the chat box at the bottom of the screen, and I will ask those questions to Cindy when we're done. Don't forget, you'll get that follow-up email. Make sure you can check that session evaluation. We'd love to get your feedback. And also, all of the links and resources will be available to you there, along with the links for today's session and all the other past sessions in case you've missed any. So please allow me to introduce our speaker for today. Dr. Cindy Thompson is a professor in health promotion sciences at the Mel and Enid Zuckerman College of Public Health, where she also directs the Canyon Ranch Center for Prevention and Health Promotion. She holds a doctoral degree in nutrition sciences, is a registered dietitian nutritionist, and co-leads the Cancer Prevention and Control Program at the University of Arizona Cancer Center, where she leads a research team whose work focuses on health promotion with an emphasis on cancer prevention and control. So this presentation will review the data on cancer risk and then demonstrate what we know about diet and physical activity that can truly change your risk profile. Specific guidance for health behaviors related to food choices and activity patterns will be discussed. Welcome, Dr. Thompson.
Thank you so much. I'm going to share my screen here. I'm really excited to be here today and talk to you about this issue of cancer prevention. And let's see if we can get full screen here. There you go. So again, thank you so much for the opportunity to be here. I'm going to spend about 20 minutes kind of racing you through the literature related to prevention of cancer, and hopefully assure you that you can work quite effectively at reducing your cancer risk if you pay attention to both what you're eating as well as your physical activity. So I don't think any of us necessarily need to know the stats, but it is important in terms of setting the context. Cancer remains one of the leading causes of death in America. 1.7 million new cancer cases will happen annually. And in fact, in this era of COVID, where people have gone inside and been less likely to complete their screening visits, such as mammograms and colonoscopies for cancer risks or cancer diagnosis, we're very concerned that the rates are going to increase even more post-COVID. So I want to start off today by just really putting out a call to make sure that you do get your screening done during this time. It's very important. What we do know about the new cancer cases is that over the last few decades, much of the increase in cancer has been related to obesity-related cancer risk. And so we're going to talk about the role of obesity in promoting cancer and what you might do to reduce your risk. And then we're continuing to make very significant progress in reducing tobacco-related and vaccine-related cancers. We have a ways to go. We still have about 18% of the population that use tobacco-related or vaping products. And certainly, we want to promote vaccinations to reduce the risk of cancers such as liver cancer and cervical cancer. But today what I want to do is not only talk about the number of new cases, but also the data that we have that really drives the role of diet and physical activity in reducing cancer rates. And I want to point out that much of the data is most prevalent for breast cancer, prostate cancer, colorectal cancer, and the obesity-related cancers in general. Our lifetime probability of developing cancer is about 1 in 3. With that excludes skin cancers, which are non-melanoma skin cancers. So there are a large number of us who will have a cancer diagnosis or will know people who are experiencing a cancer diagnosis. But before I get too far on the diet and physical activity discussion, I want to point out that while our goal is to totally prevent a cancer diagnosis in our lifetime, it is important to understand that if you follow healthy behaviors and you do get cancer, we know that your prognosis is going to be significantly better because you eat healthy and you follow a physically active lifestyle. All right, so I'm going to move forward on prevention. Why do we want to prevent cancer? Well, this is a quote from many years ago where Thomas Adams said to us, "It is a better physician that keeps diseases off us than cures us once they're on us. Prevention is so much better than healing because it saves the labor of being sick." So what I'm going to focus on today is the recently released American Cancer Society guidelines for diet and physical activity for cancer prevention. This report started about 25 years ago, and in June of 2020, we updated the evidence based on literally thousands of manuscripts that were in the literature. And these guidelines have been published in detail in a journal for clinicians and shared with you today. I had the distinct advantage of working with Dr. Cheryl Rock to co-lead this panel of experts across the US to really evaluate this literature and set the guidelines that you'll hear of today. So the purpose of the guideline is really to provide a review of all the scientific evidence on diet, physical activity, and cancer prevention. And the goal is to get that information out to people like you. We want healthcare providers to be aware, policy and decision makers, and the general public, so that people can do everything that they can to reduce the risk of cancer. Now, how do we go through this process of going through all of this literature? Well, basically, we first start with available resources, such as the American Institute of Cancer Research and the World Cancer Research Fund continues to report on cancer prevention. And they do systematic reviews of the literature that serve as one of the bases for our work. We then identify all the systematic reviews and meta-analysis that have been published since our last report, which in this case was 2012. And then we evaluate the quality of those literature and decide which should be included in the report. We want the literature that reports the number of new cancer cases or disease deaths by specific sites, as well as incidence of disease. And the exposures we were interested were dietary patterns and physical activity. There are a number of different items that we think about as we evaluate the quality of these data, and we'll get into that as we go through the guidelines. So in 2012, our recommendations are here on the left. And in 2020, the summation of our recommendations are on the right. And what you can see is that basically the achieve and maintain a healthy weight throughout your life remains a very prominent recommendation among our group. In addition, we want you to adopt a physically active lifestyle, but in 2020, what we did was we moved this to just a recommendation to be physically active and to spend less time in sedentary behaviors. In addition, we asked people to consume a healthy diet with an emphasis on plant foods, which in 2020, we really evaluated as an overall healthy diet eating pattern, because we wanted to emphasize that it's not just about adding plant foods, it's also about reducing intake of things like processed meats and total calorie intake. In addition, in the past, we asked people if they drank alcoholic beverages to limit consumption, but now we're making a direct recommendation to not drink alcohol if you want to reduce your risk of cancer. So I'm going to go through these different changes and kind of evaluate them with you, and then we'll have an open discussion. So I want to be really clear that the number of cancers associated with obesity continues to rise. In fact, new reports suggest it may be 14 instead of 13 cancers. On the left-hand side here, what you can see are the number of different cancers that are associated with obesity. Everything from liver cancer to kidney cancer, stomach cancer, ovarian cancer, endometrial cancer, colorectal cancer, and postmenopausal breast cancer, to name just a few of them. It's very important to understand that 7 in 10 Americans currently have an issue with overweight or obesity, and about half are not even aware of this obesity cancer link. Not only is it an association that we've seen through looking at basic epidemiological data, but we also know there are strong mechanistic biology that drives this link between obesity and cancer, including issues like obesity promoting inflammation or insulin resistance, suppressing our immune response, increasing oxidative stress, and damaging DNA, all of which are directly associated with a heightened cancer risk. We also want people to be physically active, and this means 150 minutes of moderate intensity activity every single week. And so if you think about this across 7 days, it's at least 20 to 30 minutes a day, and that's not asking much. I also think it's important to understand that moderate intensity means that you are getting that heart rate up, that you're feeling a little short of breath, not heavily short of breath, but at least challenging yourself. It's not necessarily just a leisurely walk, but a walk that really gives us a little bit of strain. In general, that activity should be pushed in cancer prevention even higher. And in fact, what we're suggesting is, while the general recommendation is at least 150, many of the cancers will see the greatest benefit in terms of reduced risk when you're reaching a level of 300 minutes a week, or about 40 to 45 minutes a day. So this is a really important message. And in fact, when you look at the associations for many cancers, physical activity and cancer risk shows very strong protection. And as you can see here, the top 7 cancers on this table are all strongly reduced by a physically active lifestyle. Now, where it says moderate or limited, that's generally because we just don't have as much data. It's not that the data aren't relatively compelling. So we just need to study these less common cancers in a more, in a higher number of studies over time, so that we can get a better understanding of these associations. Now, we also want you to follow a healthy eating pattern. What does that mean? Well, it means that we want people to select foods that are high in nutrients, but not high in calories. Yes, we want a variety of vegetables with all different colors. We want fiber-rich legumes and fruits and vegetables. We want fruits, especially whole fruits, that have a variety of colors and nutrients in them. And we want you to pick whole grains or bread or cereal products that really promote a higher fiber intake. But a healthy eating pattern also means reducing the things that are not good in terms of cancer risk. Things like red and processed meats, things like sugar-sweetened beverages, or any highly processed food or refined grain products. In addition, the data on red and processed meats is very strong. There have been over 800 studies that have looked at this, and there's clear associations between processed meats, which, you know, in my generation was bologna, but it's any of the processed lunch meats, hot dogs, you know, any kind of bacon, sausage, all of those processed meats are considered carcinogenic in humans. And red meats, while not as strongly carcinogenic, have carcinogenic properties, particularly when we cook them at high heats or when we grill them and have burned outer layers. When we think about high versus low diet patterns, what we see, if you look below that one line here, the dotted line, everything below that suggests that we can reduce cancer mortality and cancer risk when we eat a diet that's high in healthy foods and low in unhealthy foods. So it's very important, regardless of the diet pattern that we look at, any high healthy diet eating pattern, whether it's Mediterranean, DASH diet, healthy eating index, etc., can be protective against a number of different cancers. And we've shown this in the AARP study, in the Women's Health Initiative, as well as in the multi-ethnic cohort. What about alcohol consumption? Well, it's very important that if you are drinking it, you limit consumption to no more than 1 weekday per women and 2 for men. But what we're trying to get across with these new guidelines is that it is best not to drink alcohol at all. Doesn't matter if it's beer or it's wine or it's spirits. Alcohol itself is a carcinogenic, and it can definitely promote cancer, especially cancers of the liver and the oropharynx, as well as breast cancer. Now, here's some more associations that we see: liver cancer, as I mentioned, oral cancer, esophageal, breast cancer, and colorectal cancer. Overall, about 5 to 6% of all the cancers that are diagnosed are related to alcohol consumption. So if we had a medication that could reduce cancer rates by 6%, believe me, we would all want to take it. So it's really important that we evaluate our alcohol intake. In addition, when we look at these data that summarize the effect of alcohol, diet, and physical activity combined on cancer risk, what we see is that if we follow these healthy guidelines that I'm talking about, men can expect about 14% lower risk of any cancer. Women can expect about a 22% lower risk of any cancer. And these estimates do not include weight control. You know, if you could add weight control on top of this, you would see even more protection. So what's the bottom line? What can we really do to help ourselves? Well, for one thing, we've looked at data in a number of different cohorts now, and we've said, if people follow these guidelines, do they really have lower rates of cancer? And do they survive their cancer better? And what you see is, yes, these risk estimates are reduced anywhere from 5 to 22% when people make these appropriate behavior changes related to both diet and physical activity. So what can you do? Well, you can assess your health behaviors, monitor what's happening with your weight and get a handle on it. Make sure that you're monitoring and promoting physical activity every single day. And that doesn't just mean getting out for a walk or a jog or some other form of physical activity. It means that we need to get out of our chairs, off our Zoom calls like today, and move between our meetings so that we can really expend some energy. It can be housework, it can be gardening, it can be anything that gets you out of your chair, out of your bed, off your couch, and moving. And it's really important to engage family and friends, because we know that when we get others involved, we're more accountable and we have healthier behaviors and we sustain those behaviors over time. Also, set yourself some behavior goals. Make sure that you set some very achievable goals. Not, I'm going to lose 50 pounds by December. That's a lofty goal. Set a reasonable goal. I'm going to lose 4 pounds this month, or I'm going to eat at least 2 pieces of fruit every day, and then model that healthy behavior for others, including your children. I'd now like to open it up so that I can take questions. Thank you so much.
Thank you, Cindy. Do you want to stop sharing your screen, and that way we'll get to see both of us?
All right. Thank you.
Wonderful. That was very interesting. I always am surprised at the changes that happen over time in the recommendations, based on data. And the longer it goes, the more data we have, the better off we are to make those recommendations. And so I know that people I've always known about maintaining a healthy weight and exercising. I think some of them may, be a little put off by the no alcohol at all, but, we now see the data that's showing there is that direct link between alcohol consumption and cancer. So let's get to some questions here. It says, I am an avid golfer that plays 18 holes of golf each weekend, no matter what the temperatures. I hydrate throughout the rounds. I use sunscreen and a head cover. However, am I still at risk for skin cancer?
Yeah, so skin cancer is a whole different issue, right? I mean, it's really important. All of those behaviors that you're doing are helpful. You can also think about UV protective clothing as another way. Think about, what is your head covered with? Do you have really a large brimmed hat related to really protecting your neck and your chest area with adequate shading? So I think, it's a risk benefit that we always do, but I would say that 18 holes of golf, particularly with all the walking involved, is definitely helpful, and you are doing 90% of what you can do to promote, to protect yourself from that UV. The other thing you might think about is the time of day that you're golfing, and trying to stay away from those peak hours between 10 and 2.
Great. Do you think that the reason that processed foods can cause cancer is because of the presence of chemicals that are used to preserve or enhance the flavor?
Yeah, that's definitely part of it. There are definitely carcinogens or things that we know are not safe that we use to preserve those. When you pick up a package of bologna or processed ham, you'll notice that the sell-by dates are months and months away. Well, we know that if that were fresh ham, that wouldn't be the case. And so absolutely, a lot of it is what's added in processing. I do want to point out that, some food manufacturers are trying to reduce things like nitrosamines that are in these products, but we have a long way to go. And in addition, many of these are high fat, low fiber, not necessarily consistent with our dietary eating pattern that we talked about.
What about the risks of drinking water in pre-packaged plastic bottles?
I wish we had a definitive study. We really don't. Obviously, there are compounds in plastics that concern us. There may be pro-estrogenic, factors related to some of these exposures. We don't have the definitive study, and so you'll notice that we did look at that as we were going through to see if we had enough evidence to make a clear recommendation, and the data just aren't out there yet. And I would say that that probably is a behavior that you could easily modify, and given the potential that there may be a link, it would be prudent to make that choice.
Okay, are there recommendations for reducing dairy products and dairy fat intake?
Yeah, so the dairy is kind of complicated because, we used to have a recommendation years ago to reduce fat intake. And what we realized is that people can reduce their fat intake, but if they increase their sugar and their total energy intake, and they have low fiber and they're not eating fruits and vegetables, that's not good, right? So that's why we really moved to this eating pattern. And so dairy are a little complicated because there's some evidence that calcium in dairy, and obviously dairy is our major source of calcium, is protective against some cancers, for example, colorectal cancer. But at the same time, if we're eating full fat or consuming a lot of dairy products, it can contribute to weight gain. It can contribute to, perhaps I guess I would say dairy can fit into a healthy eating pattern, but it's not a driver in terms of the most healthy food choices. It's probably, if I had a spectrum of low to high, dairy would fall somewhere in the middle.
Okay. There was a question about mouthwash that has alcohol in it. Does that have any impact on mouth cancer?
Yeah, there's not any direct, unfortunately, in epidemiological studies, we seldom ask people about mouthwash. But one of the things that I know, there's a group out of Texas that have looked at mouthwash, not for alcohol, but because it may affect those nitrosamines. It may interact with some of those nitrosamines in foods. So I wouldn't think the alcohol would be a major issue in that the exposure is pretty low, and when you look at the link between alcohol and head and neck cancer, it's generally people who have a rather substantial alcohol intake. That said, there is another group of people who get oral cancer and esophageal cancer related to HPV. And so the vaccine, HPV vaccine actually protects against some oral or head and neck cancers as well. So there's kind of those who have a strong association with alcohol get head and neck cancer, and then HPV can also promote head and neck cancer.
Okay, we have a lot of questions coming in. Please address the role of folate in cancer protection, especially related to alcohol consumption.
Yeah, so if you are a high alcohol consumer, many times you can experience low folate status. So if we measured folate in your blood, it might be low, particularly if you're someone who doesn't take a multivitamin or a B vitamin, for example. And so there is absolutely an interaction. And in fact, folate is important to healthy DNA. And so that's a good point that, alcohol, one of the mechanisms by which alcohol may promote some cancers is by reducing folate status.
Okay. Does diet affect skin cancer?
So there are a few studies where they've looked at carotenoids, they've looked at fruit and vegetable intake. There is, I would say there are studies that show a potential protective effect, and there are other studies that do not show a protective effect. So I think what happens in this case is that UV exposure is such a driver of skin cancer that diet may play a role, but it's hard to tease out in the background of such a dominant effect such as UV.
Okay. Here's two that'll sort of go together, as they were both asking about chicken and saying chicken has a lot of chemicals, antibiotics. So is it better to use organic chicken versus a regular chicken?
Yeah, so, in general, let's just talk about organic foods. What we find is that organic fruits and vegetables have a little bit higher nutrient contents, things like vitamin C and carotenoids, etc., than non-organic. But we also know that when we're looking at chicken, we do have things like hormone exposure. The problem is that we can't easily measure that exposure, right? When in these large epidemiological studies, what we do is we ask people, we give them a list of about 150 foods, and we ask them how often they eat them, right? And when we ask them that, we don't ask how they're prepared necessarily. We don't necessarily ask about whether they're organic or not. And so unfortunately, things like the Nurses' Health Study, the Women's Health Study, the AARP study are based on pretty crude diet estimates. And so what happens is we only really get an analysis of the strongest association. We miss a lot of the more, casual or lower level exposure associations because we just don't get those details.
Okay.
Now, personally, I would say if it's within your food budget, it makes sense to avoid those, to go organic, but understand that it's better to eat fruits and vegetables and to choose lean proteins than alternatives when it comes to trying to reduce your risk of cancer.
Okay. How about daily consumption of apple cider vinegar? Does that contribute to esophageal cancer?
Yeah, no data at all, but I know a lot of people use it, particularly after working out. I actually had my son tried that and had a very significant reaction. So apparently just beware that there is a segment of the population that is allergic to vinegar. So be careful.
Hard way to find out. We have a lot of questions. I'm going to ask this one more because we're right at time, and then we'll get to all the rest of those questions. Cindy will follow up with answers in the follow-up email. But someone was asking if you said there was a vaccine for liver cancer, and also how does inflammation relate to cancer and what types?
Yeah, so I'm just talking about the hepatitis vaccines that can be protective for some forms of liver cancer. And then what was the other one?
How does inflammation relate to cancer?
Yeah, so inflammation promotes tissue damage that can then potentially progress to cancer. Remember that cancer is what we call a multi-hit disease. One inflammatory situation is not going to cause a tumor to develop. What it is if you have particularly chronic low-grade inflammation, which we see in people who are overweight or obese, that can set up a situation where your body is constantly trying to repair that tissue, and eventually the immune system will not be able to control the growth of a tumor. So it's one factor alone. It's unlikely to cause cancer. It's got to be oxidative stress and inflammation and, a number of different factors, multi-hits over the course of our lifespan that eventually result in a tumor.
Wonderful. Well, thank you so much, Cindy. I know we're over time. There are still some more questions. I will make sure and have Cindy answer those, and we'll put them in the follow-up email. So thank you again so much for your time. I know how busy you are. I really appreciate it.
Thank you. It's been wonderful. Bye-bye now.
Bye. So thank you, Cindy, for all those wonderful, wonderful information. And like I said, we will do a follow-up with all of the questions that we did not get to in this session. So in that email, you'll also receive the link to the recording for today's session. So if in case you want to listen to it again, it'll be in there. And there'll be also a link to all of the virtual events so that you can get the whole calendar of events with everything that's going on at Health Sciences. Next week, we've got a wonderful one of our alumni coming back. We have Dr. Michael Goldstein. He is a proud U of A alumni. He's now working with the Harvard Medical School, and he'll be talking about a study that he did about the use of yogic breathing to improve your ability to cope with stress. It's very fascinating, and he's going to be actually taking us through some yogic breathing processes. So it'll be really fun. So I encourage you to join us and to share it with your friends. So until then, on behalf of us at the University of Arizona Health Sciences, be safe, be well, and of course, bear down, and don't forget, mask up. See you next week, everyone.